In medical school, I lost my best friend to a fentanyl overdose in 2015. And that wasn't something that, that was planned for life. He didn't expect to die of that. And it was really in 2015 when we started the fentanyl crisis, we saw people dying. And it wasn't just the, quote, junkie on the street, that I had thought that I had been fed in my training and in my personal life. Oh, people are with addiction are the other. They're not. They're people who use substances are doing something bad because that's what the media tells us. That's what other people tell us. But when it hit close to home and said, "Hey, this is someone who is in medical training and kind of had everything he wanted. He didn't expect to die that day. And people aren't expecting to overdose when they're overdosing. Like, this is a national crisis that people are overdosing from an adulterated drug supply. My name is Cara Zimmerman. I'm a physician doing internal medicine and addiction medicine here at Thundermist. I'm the medical director for primary care-based substance use disorder treatment. So I treat a lot of people with addiction and chronic pain and a lot of cool primary care patients. I was hired just as a primary care physician, not just, but just treating primary care patients. And then I have a background in addiction medicine training. And I really, when we talked about what role I wanted to fill at Thundermist, I really was very interested in continuing on my addiction medicine training. And Thundermist was very agreeable to that. We know that a lot of people with addiction do not see an addiction medicine specialist. They're seeing their primary cares. So my role kind of became taking what I learned from addiction medicine and teaching my colleagues so that they can feel comfortable in treating their own patients with complex substance use disorders. And as we know, addiction is a family disease, and it affects all walks of life. So they're not coming to the clinic maybe to talk about the addiction, but we as primary cares know that it can affect a lot of different things in their life. We take a very different view of addiction in general, as opposed to something like diabetes or heart disease that does have lifestyle interventions as well and lifestyle factors as well. But I think the stigma behind addiction makes it so that a lot of training programs aren't really talking about it. And we kind of, at Thundermist, are trying to level that playing field and level that gap and say, hey, no, we're seeing people as human beings. And yeah, they might have addiction that is causing, or unsafe substance use that is causing risky things in their life. And how can we better help them? And we're not saying, oh my goodness, you have to be completely abstinent or else we're going to kick you out of clinic. No, like we're being harm reductionists. We're meeting people where they're at and seeing where they are on the map. And if they want to get help from us today, that's great. If they want to get help from us from a month from now, we're still going to be open to them. We're treating someone as a whole person. And I think, at Thundermist in general, it's a very good idea. They have everything on the wall that says, you are welcome here and we take anyone. And that is something that I live and breathe every day. I am Thundermist.